Good morning and welcome to Leon County Today with Sheriff Walt McNeil. We are back for another episode, Sheriff. We're kind of on a roll with these things now.
Tuesday once again, and my partner and I in crime are here for the citizens of Leon County.
Absolutely, and we've got another full show for everyone today, and this really focuses on the services at the Leon County Detention Facility. And before we go into our latest partnership under this all-in umbrella, I want to go back to initially the renaming from the Leon County Jail to the detention facility. What was that all about?
Well, one, Sean, when the facility was first built, it was built as a detention facility, and what that meant was there was not an expectation that people would stay there for an extended period of time, not up to a year or so. The idea was to get people in and out. But knowing all the problems we've got now with mental health issues, I wanted to make sure when I came in as sheriff that we had a focus on what that detention facility was about. It was not about housing people with mental health issues or people with long-term problems. We were supposed to get those people back into the community. And quite honestly, we don't have the resources and the assets in this community to allow that detention facility to function the way it should. And so what I want to do is put a focus on what are the outcomes we're looking for? What is this detention facility supposed to do? And it's built around collaboration with our social service partners, with our mental health community, with children advocates. We aren't supposed to have that many juveniles in our facility. We have something on a net magnitude about 16 from time to time, and that's not what it should be. So I wanted to make sure this community focused on a reality of what this facility is all about, what it should be about, and then how can we make it live up to what it was built to do, how it was built to perform.
Yeah, and we've really, there's really been some real strides made in that effort. You look at just on the reentry side and all of the educational programs now, and the whole goal to this is reducing recidivism. Absolutely,
and we're on the way to trying to do that, but there is so much more that has to be done. The mental health piece is so a major focus on our being able to drive down crime. I've said over and over again, these issues obviously require law enforcement responding, but the apex and the reason behind the crime has everything to do with the social problems we have in our community. And that's why our refocusing the community's efforts and the community's focus on their detention facility and working with those social service programs are so important in this community.
Absolutely.
I can't emphasize that enough, Shonda. We really have to get our community behind these social service programs if we're going to drive crime down in this community.
Well, speaking of the health component, what we're talking about today is a new partnership that the Leon County Detention Facility has with the Bond Community Health Center over there.
Yes, I am really excited about this opportunity. It is, as I said before, it is a crucial part of what we do. I think people know that, we've said this over and over, about 40% of the population in our detention facility are people that suffer from mental health issues. A big part of our budget is those psychotropic drugs that we have to keep providing for people who are coming in, and that pushes the cost back to our citizens. I've said over and over again, what I don't want to do is, in this term or my next term as sheriff, have to build another detention facility. And we're at about 954 inmates at this point. And again, 40% of that being people who are suffering from mental health problems.
Absolutely. Well, we're going to dig a little deeper into this issue today, Sheriff. So coming up next, we will talk with the CEO of the Bond Community Health Center about the new partnership with LCSO and what it means for the health of inmates who will eventually reenter society. Stay with us.
In times of stress, such as quarantine, what goes on behind closed doors can be terrifying, but you don't have to suffer in silence. Help is here. Love is not controlling. Love is not frightening. And love is not violent. Love is respect. If you need assistance or just want to talk, we are here. Contact the Domestic Abuse Hotline at 800-500-1119 to speak to someone in your area. For more information, visit thedvcc.org.
I'm Andrew Saul, Commissioner of Social Security. Beware of telephone scammers pretending to be government employees. Real Social Security employees will never threaten you. Callers threatening you with arrest or other legal action and demanding money are not from us. If you receive a call like this, hang up, do not provide them with any form of payment or information, report the call at oig.ssa www.leoncountydetention.gov.
In every family, small conversations can make a big impact. I grew up on tour with my parents. Kind of different, but we bonded over music and we talked. Honest conversations, like when my dad shared his experiences as an alcoholic. Your honesty gave me a sense of integrity that I wanted in my own life.
And I wanted you to know, from someone who's been in recovery more than 30 years now, that hard work is what creates success, not alcohol or other drugs, in whatever you do.
Talk, they hear you.
Here's to the things that can keep us safe. Those we use all the time with hardly a thought. Those that are silently standing by to save our lives. And now, those that we carry with us everywhere we go. Many mobile devices will now bring you wireless emergency alerts, real-time information directly from local sources you know and trust. With the unique sound and vibration, you'll be in the know wherever you are.
Welcome back. We are joined now by the CEO of the Bond Community Health Center, Dr. Temple Robinson. Dr. Robinson, welcome to the show. We are so delighted to have you.
Thanks for having me. I'm happy to be here. Thanks for having me.
Well, Dr. Robinson, tell us about the health center and how the Bond Community Health Center, partnering with the Leon County Sheriff's Office, is so crucial to our community.
Well, Bond Community Health Center is all in.
All right.
We're all into. And our providing this new service is just an extension of our mission, and that is to provide access to quality health care for all people in our community. Bond's HIV provider team, we will be consulting with the medical team at the Leon County Detention Facility to offer focused HIV care. The services will just be an extension of the comprehensive services that are already at the provided by the detention center. The services will be convenient for the inmate and for your provider staff, and we'll render this care on our mobile unit. We'll come in about once a week and be on standby for any urgent needs. The service will establish the medical protocols that will mirror those HIV treatment protocols that you will see in a federal Ryan White HIV program.
Now, we talked about HIV. What does that mean in terms of our community, the impact we're going to have in the community?
Well, this will be big. You spoke earlier about the detention facility not being a last stop. We want people to be healthy when they are released during that early entry period, when that re-entry period. When people are released, we want them healthy. So this new partnership will help, one, Bond's providers and support staff assure that our patients or the community patients are not lost to care, lost to follow-up. We will assure that other inmates or people who are newly diagnosed with HIV, unfortunately, if they're at the facility, are linked to care, so they have a medical home when they get out and they're healthy. And it will help your staff then benefit from our expertise in HIV services.
Now, you talked about HIV. You know, one of the things I've talked about quite extensively is the mental health piece of that.
Correct.
Talk to me about the mental health piece and how you guys are going to help us in that regard.
Well, our HIV patients and your HIV patients will also have the benefit of those support services. So HIV patients need a lot of hand-holding. So we'll have case managers. Those case managers will link those patients to mental health services or behavioral health case managers or substance abuse resources when they come out of the detention center. We'll also make sure that if they stay in our area, the inmates stay in our area, that they get connected back with their primary care physician. We want to make sure that the coping skills are there so that whatever regimen, a medical regimen that the inmate's on, they can stay on that medical regimen and assure that their viral load is almost what we call undetectable and thus less likely to spread HIV in the community.
You know, I'm always talking about the volume, the number of people coming into our detention facility.
Yes.
I talk about it, I say 40% have mental health issues.
Right.
How about the HIV problem? How pervasive is that?
Well, sometimes we use the phrase mental health and sometimes we use the phrase behavioral health. But I would venture to say anybody who has HIV, whether it's detectable or whether the viral load is undetectable, has some level of anxiety at some point, some level of depression at some point. And it's there's a comorbidity there with mental health illness. I can't give you the exact percentage, but I can tell you that most patients that I know definitely have anxiety, depression, poor coping skills, and are frequent to make bad decisions. Sometimes those decisions, they end up with you.
Well, Dr. Robinson, thank you so much for the information you've shared with us. We are so fortunate to have Bond Community as our partner as
Yes.
we move forward to deal with these issues. As you know, we're trying to get that population down, both HIV and mental health.
That's correct.
And it's because of the great work that you do that makes all that that's so important for us and makes it happen. Thank you for being with us today.
Thank you, and we're proud to be your partner.
Thank you. Up next, Assistant Sheriff for Detention Services talks about why this new partnership would be a game changer and other initiatives to help reduce the recidivism rate. Stay tuned.
Every year, the Salvation Army serves nearly 30 million people in need. That's one person every second. So by the time you've finished watching this, 30 more lives will have been changed for good. All thanks to your donations.
Thank you.
Give today.
I've been driving a truck for 40 years now. If people knew what I know, lives could be saved. Like that trucks can't stop quickly. It takes my 80,000-pound truck 200 yards to come to a complete stop. So I always do my best to give a lot of cushion. It helps when other drivers realize that and do the same. Please give trucks the space we need so we can all stay safe. It's our roads, it's our safety.
Why? Why do we ignore the things that give us pause, that seem out of place, that don't feel right? The answer to why defines who we are. So if you see something, why do you say something?
I see safe for my friends.
For my community.
For my family.
For each other. Because all of this matters. We all have something worth protecting. So why do you see safe? Report suspicious activity to local authorities. If you see something, say something.
Water, extra mask, lunch,
Hey, Graham,
snack.
what you up to?
I'm getting ready to stand in line and vote.
But the election isn't for weeks. Why are you packing now?
Oh, I heard the lines are going to be really long, and I'm just preparing.
Well, what if I told you I was actually getting ready to vote too?
Wait, how? Where's your face mask and sanitizer?
I'm on the U.S. Vote Foundation website requesting my vote at home ballot. That's how. And when it arrives, I'll fill it out, take it to the mailbox or Dropbox, and my ballot is cast. Let me show you how.
Skip the line. Request your vote by mail ballot from U.S. Vote Foundation today.
Army National Guard soldiers have the option to train and learn skills in the trade fields, skills that can lead to employment at home as well. Find out how you can learn a trade and serve part-time for your community and country by visiting nationalguard.com.
We're back with Assistant Sheriff for Detention Services, Steve Harrelson, to talk to us about HIV and our partnership with the Bond Community Health Center. Steve, talk to us about how that's going and what deliverables are we looking for from that relationship.
Well, thanks, Sheriff, for having me back today and everything. We are super excited about this partnership with Bond. What this is going to allow us to do is to, when we do what we call a soft or warm handoff to the community of the inmate back into the community, they now have a source to go to in the community when they're dealing with HIV, which is a very serious medical condition to deal with. So in the old days of detention, when your time was up, we put you out the door and that was it. With our new initiatives for reentry, and this being a small piece of it with the partnership with Bond, is we're trying to give the returning citizens, the offenders, a source out there in the community that they can go to, so they'll have somebody to deal with it. And on this very serious subject of HIV, they now have a community resource that they can do the continuum of care once they leave our facility. So it's just a simple handoff from us to the community, a resource in the community to be able to continue with their care.
So, Steve, explain to the audience, what does that mean for us in the Leon County Sheriff's Office, and what does that mean for the community to have that kind of handoff?
Well, the Sheriff's Office being a community agency, we want to have these partnerships in the community because, as our motto is of all in, it's more than just the Sheriff's Office trying to reduce recidivism in the Leon County area. So having these partnerships, we're able to provide more services to the inmate, services that were there, but we're just giving them the right direction to go at this point in time. So we give them more resources, more tools. The hope is of this program, along with the other programs that we were doing, is we give them other avenues to go down so they won't be returning back to us. So there are other alternatives for them besides committing crime, that they can have these resources and actually become a productive citizen of society.
Well, Steve, you're doing a great job there in our detention facility, and I'm really excited about all the things we're doing. Why don't you, we focus on all in. All in's about all of us pitching in where we can to do the job of protecting this community. Talk to us a little bit more about some of the other programs and initiatives we have in the Sheriff's Office.
Well, people say all in is a catchphrase. All in is our way of life right now. I mean, it's about everything we do. We're about the citizens of this community, and the inmates that we have at the detention facility are the citizens also. They're just kind of returning back to society with kind of a mark against them because now they're returning with a record, and some businesses are kind of leery about doing that. So what we're doing in our reentry through our RISE Center and also with our new program Pathways, which is the old work camp, we're giving them actually pathways to go down. So if we find a certain individual who might have been a shade tree mechanic their whole life and no cars in and out, which I'm kind of jealous of that trait, but they never had any formalized training. So what we do is we actually have a program designed that they can actually come into our fleet, and with our fleet manager can actually go through a program sanctioned by the courts. This is part of their sentence that they would get. They have to actually go to this training, and when they get finished with the training, then they walk away with a certificate for the ASC certification. So that gives them another tool, so when they're out looking for the job, they have something to carry with them other than just a criminal record. And while they're going through the training program, our RISE Center folks, which RISE stands for Reentry Innovative Services and Empowerment, and that's exactly what we do. We give them innovative services, and that's exactly what this is. It's not something that you see on the shelf at any other agency. This is brand spanking new what we're doing. And what we're trying to do is give them the tools so they can go out and be productive. And while they're doing that, our RISE Center folks are looking for a job for them. So we have these partners in the community that have said, if you have viable candidates, we would like to hire them. We're not worried about their criminal record. So these additional partnerships allow us to do not only what our basic job is of law enforcement, but helping the community and the citizens returning to the community.
Thank you, Steve. That was an in-depth description of what we're doing. I'm so proud of the job you're doing, and it's making an impact here in Leon County. Thanks again, Steve, for the great work.
Thank you.
Coming up, you see them at the courthouse entrance and at the courtroom. But what exactly is the role of deputies at the Leon County Courthouse? That's in our Deputy on Duty segment. Next.
Here's to the things that can keep us safe. Those we use all the time with hardly a thought. Those that are silently standing by to save our lives. And now, those that we carry with us everywhere we go. Many mobile devices will now bring you wireless emergency alerts, real-time information directly from local sources you know and trust. With the unique sound and vibration, you'll be in the know, wherever you are.
Before you throw away those unused medicines,
those pills for your back pain or migraines,
just think for a minute. When you throw them in the trash, they can become lethal in the wrong hands. There are better ways to dispose of your unused meds.
There are lots of police stations, local pharmacies, and hospitals that are approved to take in unused meds
and dispose of them safely, so they don't end up in the wrong hands, our hands.
To find a medicine disposal site near you, visit www.safe.pharmacy.
Here you go.
Thank you.
Thank you.
All rise, court is in session. The Honorable Judge Nina Oshinoff Richardson presiding.
I'm extremely blessed and very proud to work with an incredible group of people in the bailiff unit. A lot of people have no idea how much work this relatively small group of people are able to get done. At 8 o'clock we have our check-on where the majority of our employees meet and gather their assignments and review their assignments. And they also go through check-on training during that time. And there are different types of discussions, whether it be policy, procedure-wise, just catching up on emails, things like that. All that takes place around the 8 o'clock hour. Generally, after check-on is over, they will have a few minutes to run, get a bite to eat, to go take care of some business if they need to, and then they'll generally be in courtrooms by about 8:30.
We do a pre-courtroom screening, so before it's open to anybody coming in there, the bailiff assigned to that courtroom will do a sweep, a security sweep, looking for anything that doesn't need to be in there, weapons or just anything that doesn't belong in there. There's some emotional moments in the courtroom, sentencings, especially where somebody has taken somebody else's life, and family members are in there from both sides, and they get up to speak. Some of that can be very emotional and raw. Those kind of moments, and we have unfortunately too many of them. Those do kind of stand out when you're in there and present for that. The heartfelt testimony of a loved one of a victim, or even a loved one of somebody that's been accused of doing something. It kind of cuts both ways.
There are people that have to be in court all of the time. The transport unit for the bailiff unit transports over 8,000 detainees back and forth between detention centers and courthouses, and detention centers and departments of correction. Again, it's a very small group of people. 6 people comprise our transport unit, but they're able to move 8,000 inmates or 8,000 detainees on a yearly basis. Out of 32 people, many people would have no idea that the Leon County Courthouse, what we're statutorily bound to secure, and our primary focus of our job in the bailiff unit, these people screen almost 300,000 citizens at the public entrances a year. They also screen over 300,000 bags or purses or briefcases or articles at the same time. That is a huge volume of people that are having face-to-face contact with different members of the Leon County Sheriff's Office.
We have an x-ray machine and a metal detector. The metal detector is a walk-through machine. So if you have any metal objects on you, it'll alert, and there's a zone that it alerts to. Sometimes it alerts to more than one zone, but then we have a handheld metal detector wand that we utilize to isolate what is setting off the machine and ask the person who's responsible for setting the machine off, what is that, and so on and so forth. And every package that comes in the building goes to the x-ray machine. So we screen a lot of people and a lot of packages every day. We man the door from 7:15 a.m. till court closes, and that can run till midnight some days. So.
This same group, like I said, also makes about 200 to 225 arrests a year, in addition to securing the court and securing the entrances and screening all the people that come in. So this is really an incredibly diverse, incredibly talented, and well-seasoned group of people that we are very proud to call the Bailiff Unit.
In the wake of a natural disaster, it's easy to ask, what difference can one hammer make? At Toolbank, we ask, what difference can we make with a hammer? We lend hundreds of tools to help communities respond and recover after natural disasters. But these tools do more than just clean up. They help restore hope, build communities, and foster opportunities to pay it forward. At Toolbank, we believe in making a difference, one community at a time.
Just 30 seconds of your life will echo through history.
To free their children.
This country.
The President of the United States.
Visit vote.org to participate in this landmark election. Vote what you start.
Welcome back to Leon County Today with Sheriff Walt McNeil, and it's been another full episode, Sheriff. I learned so much today about the reentry services at the detention facility.
Yeah, this has been one of the most informative sessions we've had, simply because it's so important to us. This mental health and the HIV, AIDS issues are so dynamic in our community and have such long lasting impacts that are negative. And what we saw today is that there are some positive aspects of what we can do in our community to turn that around. And I'm so hopeful that the citizens of this community grab hold of these issues and understand our All-In initiative is not just about locking people up, but it's about how we can all pitch together to deal with the issues that we have in our community so that we can get us in a different place. As I've said, Sean, a number of times, if we're going to drive crime down in Tallahassee, Leon County, it's going to start with those social programs and building those up so that they have the capacity to deal with the problems we have, and let law enforcement go into the role of keeping our community safe from a law enforcement perspective and not in social services.
So very well said, absolutely. So we definitely want to thank our guest, the Bond Community Health Center, for being all in for sure.
Absolutely, absolutely, great job.
All right, and before we let everybody go today, Sheriff, we want to tell them coming up next week, we're going to be talking about wearing the mask.
Yes, absolutely. I've talked about that. You've seen the billboards around town, the trailers on the streets that speak to just wearing a mask. We know the CDC has said if we wear our mask, we can cut this virus down exponentially, and we want to do that. And it's going to take you, the citizens of Leon County, to make that happen.
Awesome. Thank you so much, Sheriff, and thank you all for joining us for another episode. We'll see you back here next Tuesday.